Hello, today I'll be telling you about polycystic ovarian disease, which is PCOD or PCOS, and its implications on skin. I make videos on skin related concerns and on hair transplantation. If such content is of interest to you, then please subscribe to our channel. Polycystic ovarian disease is a common condition today. It is thought that it affects about 6 to 8% of women. It is more on the rise nowadays because of our lifestyle changes. Our lifestyle is more static now. We do not exercise as much and it is more sedentary, more of desk work, which is leading to more of PCOD. Also, it has been seen that stress could be a contributing factor in development of PCOD. And a better understanding of the disease. Now we look at even the clinical features along with laboratory investigations, that is blood tests and an ultrasound to view the ovaries. We look at all this and then make the diagnosis of PCOD. So a better understanding of disease has made us diagnose this condition even more. So the most widely used criteria for diagnosis is the Rotterdam criteria, where they look at three things. One is your menstrual cycle irregularity. If the duration between your cycles are more than 35 days or you're having less than 8 cycles in a year, that is one of the criteria. The second is if you are showing any features of increased testosterone in your body, such as increased facial hair, if you have acne, if you have thinning of scalp hair, all this can also point towards the diagnosis of PCOD. And the third criteria is having cysts in the ovary, which are visualized after doing ultrasound of the pelvis. So if any two of the three above features are found, then the diagnosis of polycystic ovarian disease is made. So when do you start noticing PCOD? It starts when you start having your periods, your menses, and it can also be seen in adult women. It usually gets diagnosed when a woman is trying to conceive and is having difficulty during that, or she has complaints of increased facial hair or acne or thinning of hair on the scalp. Then this leads to the suspicion of PCOD. So what are the causes of PCOD? The exact cause for this condition is yet not known. It is thought that there is some genetic implication which is predisposing people to develop this condition. So certain changes in the genes predisposes people to develop PCOD. So it has been seen that if your mother or sister suffer from PCOD, then there's a high likelihood that even you could have the condition. This condition occurs due to an increase in the level of testosterone, which is a male hormone. So this leads to male-like features like increase in the facial hair or deepening of the voice or thinning of hair on the scalp. So there is an increase or an excess of the testosterone in the body. This increase of testosterone is known as androgen excess. Along with this, it has been seen that people with PCOD have increased insulin levels in their body. So there is an insulin resistance. Level of insulin increases because the body is not able to utilize the insulin that is present in the body, right? So there is a mechanism which makes the body feel that there is not enough insulin because the body is not able to utilize it. So more insulin gets made by this organ called pancreas. So this is why there is an insulin resistance and excess of insulin. This leads to features that we see like darkening of the skin, and darkening and thickening of the skin and the body folds are all due to excess of insulin. And this insulin resistance is worsened by obesity. If you have abdominal obesity, like fat around your abdomen, you have a large stomach, then this can lead to more chances of developing insulin resistance and also androgen excess. So having a static lifestyle, sedentary lifestyle, less exercise, less physical activity also contributes to development of the condition. So what are the skin manifestations of PCOD? So when you have polycystic ovarian disease, what do you see on your skin? So there are a few features which are very commonly present. First is acne. So you could have a lot of acne on your face, and there are certain features which are very typical of acne seen in PCOD. So these lesions are usually on the jawline, on the lower part of the face. It can even extend to the neck, to the chest, even shoulders, upper back. Even these areas can have acne. And these lesions are usually larger. They are more red, larger, more nodular, cystic, little painful. These large lesions are deeper seated, and there can be multiple comedones which quickly turn into red lesions. So there can be a lot of whiteheads which are quickly becoming into red acne lesions. So these are the usual features of acne seen in PCOD. Along with this, you might develop a sudden flare of acne just before your menses. 2 to 3 days or about a week before menses, you could notice that you're suddenly developing a lot of lesions. Also, these lesions tend to last longer. Let's say usually acne lesions last for about 5 to 7 days, sometimes up to 10 days. But these lesions tend to last for weeks. And this acne is treatment resistant. It's not showing response to the regular acne medicines. So that is one pointer where you start thinking about any hormonal imbalance that could be the underlying cause for the acne, when your acne is not responding to conventional regular treatment for acne. And also, as soon as you stop the treatment, it can promptly relapse. Relapse just suddenly after stopping the treatment is also one of the features. Along with this, if you've had family history of severe acne and family history of acne which is also very difficult to treat or treatment resistant, then this points towards an underlying hormonal imbalance. I have made a whole video on hormonal acne where I discuss in detail the features of hormonal acne as well as how to tackle it. If you want to watch it, you can just click in the iCard above. And sometimes in PCOD, you might not develop acne, frank acne, but your skin appears very oily, So because these hormones, these androgens stimulate the oil forming glands to make more oil, so your face appears more oily and shiny, and that could be the only manifestation. Another common feature in patients with PCOD is increased facial hair. So they complain of thickening of the hair. They have coarse dark hair along the jawline, over the upper lip and on the chin area. So see, there is certain population in which people do have increased facial hair and thick hair compared to normal. But this can be familial. It need not always be due to an hormonal imbalance. So just having a lot of facial hair not always mean that it is a hormonal imbalance. Sometimes it is constitutional or familial, means in the family everybody has thicker hair. But there are certain areas where if you have thick hair, then it implies that there is a hormonal imbalance, such as in areas such as upper lip, on the sidebone area, in the chin area, on the chest, on your abdomen area. These are more sensitive towards the changes with the male hormone, right? So if you have thick, coarse, darkly pigmented hair in this area, then it could point towards PCOD. Apart from this, there could be generalized darkening of the skin color, or what we call acanthosis nigricans, where there is thickening and darkening of the skin folds. So you will notice that you have dark underarm area, your neck area appears dark, your groin area appears dark, and the skin there appears thickened. This is known as acanthosis nigricans. This occurs due to increased insulin levels in the body. So what insulin does is it stimulates the skin to become thicker. So the skin becomes thicker and then it tends to appear darker. So there are multiple folds on the skin and the skin appears darker, which is more prominent in the folds. So like the neck, in the armpit, groin, below the breast, which is the inflammatory area, in these areas you will notice that the skin has become darker. Along with this, you can even notice darkening of skin under the eyes, around your mouth, and even on the sides of the forehead or the sides of the face. So these areas can also be affected by PCOD and due to insulin excess. You can also have thinning of scalp hair in PCOD. You will notice that from the place from where you part your hair, the parting area has widened, or you feel that there is thinning of hair in the frontal area, like it is more see-through, and even on the second or third day after you wash your hair, When there is a little bit of oil on your scalp, you feel that your scalp is completely see-through and your hair appears very thin. This could also be one of the manifestations of PCOD. So you might not necessarily always have frank hair loss. So some patients do complain of hair loss, but most women complain of thinning of hair, which is mostly concentrated in the frontal area. The level of fat cells in the body also impact the level of hormone. So if you have abdominal obesity or a lot of fat in your body, that can lead to increase in these hormonal levels. So it is generally seen that people with PCOD are overweight or obese, but that does not mean that if you are thin, PCOD can completely be ruled out. No, there's a variant called lean PCOS. So even patients who are thin can be affected by PCOD provided you show the other features of the condition. Patients with PCOD could also have hypothyroidism. So usually when we do a hormonal profile, we also check their thyroid levels to see if they are within normal limits. So how do we evaluate a patient of PCOD? So whenever we suspect a patient of PCOD, what do we do? How do we approach? So first, a detailed history is must, right? So we always get into the history of your menstrual cycles, how regular they are, what is the duration between your cycles, how much do you bleed during the cycles, and if you struggled with fertility, if you've struggled with trying to have a baby, all those factors are taken into account. After this, we do certain blood tests to look for your hormonal levels. Mainly, we look at testosterone levels, DHEAS levels, FSH, LH and prolactin levels. These hormonal tests are usually done on third or fourth day of menses. Along with this, we look into your thyroid and your insulin levels. Along with the blood test, we also do ultrasound to visualize the appearance of the ovary. So even this ultrasound is best done on second or third day of menses. Okay, so we look at the size of the cyst, how the appearance of the cysts on your ovaries, how they are arranged, all of this, and the volume of the ovaries, all of these features will help us in making the diagnosis of PCOD. So once we are sure of the diagnosis and we are sure that you're suffering from PCOD, then what do we do? How do we manage and treat? First and foremost, lifestyle modification is a must. It is the most important aspect of treating a case of PCOD. So we have to make certain lifestyle changes, try to have a healthy diet, kind of cut down your fat intake and your carbohydrate intake, try to exercise at least for an hour every day, and eat healthy along with regular exercises are going to help in maintaining the body weight. Also try to lose weight, try to keep the BMI within normal, that is below 25. So we will have to take the measures to reduce the weight and lead a very healthy lifestyle. So we need to increase the intake of fresh fruits and vegetables, increase the amount of fiber in our food, and reduce the carbohydrate and fat. So it is best to consult a nutritionist regarding this so that they look into what you like, if you're a vegetarian or a non-vegetarian, and give you diet accordingly. So eating a healthy diet and having a regular exercise routine is very important if you're suffering from PCOD. It has been seen in various studies that even if you reduce your body weight by 2 to 7%, it can lead to quite a good improvement in your hormonal levels and your ovarian function. So weight loss, trying to be of the ideal weight, and leading a healthy lifestyle is very important. So treatment of PCOD cannot be generalized for everybody. We have to look into the fertility history, whether they are planning to have a baby or not, and how regular their menstrual cycles are, what are their major complaints. We have to look into all this before we start any medicine. So the medicines are usually of 3 categories. One is oral contraceptive pills or hormonal therapy. Second is insulin sensitizing agents such as metformin, which will help in regularizing your insulin levels. And third is non-contraceptive hormonal agents such as spironolactone or even finasteride in certain cases. These medicines are usually taken for a period of about 6 to 8 months, maybe longer depending upon how you respond. So the choice of treatment depends upon multiple factors. So oral contraceptive pills which contain estrogen and a non-androgenic progesterone is usually the first choice of treatment if you're suffering from acne and increased facial hair. Okay, so we look into other factors as well. We can even add on a cyproterone acetate, which works well in cases of acne, which is marketed as Diam 35. Along with this, we can even add a spironolactone, which will help in normalizing the hormones. So the choice of treatment depends upon what your concerns are, what your skin complaints are, along with that how irregular your menstrual cycles are, and also what are your fertility requirements, right? So if you're planning to have a baby, then we'll put you on some other medicines. So the choice of medicine depends upon multiple factors. Along with this, we usually add a metformin. So it helps in regularizing your insulin levels, also helps in losing weight. Metformin is a very good medicine in patients suffering from PCOD. So you can discuss these agents with your doctor, but it is up to your treating dermatologist or a gynecologist to take the decision as to which agent to use. So you must understand that there are many reasons for PCOD and there is no one treatment that can fit all types of PCOD. We have to look into many factors, and also it is a slightly chronic disease. So it is not that once you take medicines, all your symptoms will go away. No. So along with your nutrition and your exercise and lifestyle changes, you have to take few medicines also to keep the hormones under check. So it is usually a multidisciplinary approach where a dermatologist, a gynecologist and a nutritionist together make a plan for you so we can tackle your condition better. I hope you found this video useful. If you like the video, please press the thumbs up button and also subscribe to the channel. In the comment section below, you can let us know if there is any topic you want us to make videos on. So if you like such skin and hair related content, you can follow us on other social media handles such as Facebook, Instagram and Twitter. Thank you for watching.